Today, we're going to talk to you about your journey to overcoming stroke. With the help of my friend, Ron Dillon, the president of the Greater Knoxville Area Stroke Club, we're going to cover some advice and steps to help you on your journey.
My name is Ron Dillon. I am a golfer, and I am a person that drives my own car and do as much volunteer work as I can do. I am a person that does my own yard work. I am a person that does as many activities as possible that I can possibly do. I do by myself. I have water skied, and I am a stroke survivor.
There are three major areas of the brain: the cerebrum, the cerebellum, and the brainstem. The cerebrum is the largest and most developmentally advanced portion of the brain. It controls a number of higher functions, including intellectual and emotional functions, smell, speech, judgment, foresight, and voluntary movement, pain, heat, and other sensations, comprehension of language, hearing, primary visual area, and speech comprehension. The cerebrum is divided into the left and right hemispheres. The left hemisphere controls the functions on the right side of the body, as well as speech and language abilities. Strokes in the left hemisphere can cause right hemiplegia, aphasia, and development of a slow and cautious behavioral style. The right hemisphere controls the left side of the body, as well as analytical and perceptual tasks. Strokes in the right hemisphere can cause left hemiplegia, problems with spatial and perceptual abilities, and the development of an impulsive behavioral style. The cerebellum is the second largest part of the brain and controls things such as reflexes, balance, and certain aspects of movement and coordination. Strokes in the cerebellum can cause abnormal reflexes, coordination and balance problems, dizziness, and nausea. The brainstem controls functions necessary for life. For example, breathing, digestion, heartbeat, alertness, and the state of being awake. Strokes in the brainstem affect involuntary functions and may cause paralysis in one or both sides of the body.
16 years ago I had a stroke, and it was caused from a dissection of the carotid artery bleeding into the brain, which caused the loss of brain cells by from the bleed, and blood cutting off flow to the other parts of my brain also. I was on a plane in Canada. I had gotten up the night before. I had a bad headache, and I'm not, at that time, not recognizing that lead up to a stroke. I had seen where I'd woke up during the night and I had thrown up on myself, and I was sick. And sick still the next morning, had a terrible headache the next day, and went ahead and got on an airplane, which I'm convinced to this day if I hadn't got on that airplane, I wouldn't have been as severe as I am today because of it. But I went ahead and got on an airplane, and they said that we had just taken off and they had pressurized the cabin, and when they did that, they said it hit, and they all thought I had really died at that point in time because they had people on there that tried to help. They made an emergency landing in Montreal to get me off the plane, take me to a hospital there in Montreal. They transferred me from UT Hospital to Fort Sanders Hospital. After I'd been there for about a week, the doctors came in and said that I would probably never drive again, never walk again, never work again. And I told the doctor at that point in time, you don't know what me and the Lord can do.
But we know there are ways to improve after a stroke. Of course, physical therapy is always important. Exercise is something that stroke survivors tend to overlook, but also plays a key role. Patience and perseverance are required when adjusting to your new life. Goals give you something to work toward and give you a sense of accomplishment when you achieve one. A positive attitude will help you succeed in your endeavors. Let's start with physical therapy. We all know that physical therapy is highly important to recovery after a stroke. But did you know that exercise is equally important? Physical therapy should be used as one aspect of an exercise routine, but not the whole.
And started looking all over the country trying to find things that could help me with my recovery. I happened to see the quadricizer advertised on TV or in the paper, and then that's when I contacted Larry and was able to start working with the quadricizer. And then I went to a therapy place, and they had bought a quadricizer, and we all thought it was the greatest thing because after we use a quadricizer, it relaxes in the tone and what have you, helps us greatly.
But what is the quadricizer? Let's take a closer look at this motorized physical therapy system.
Our bodies were meant to move. Increase your range of motion. Movement equals improvement. Introducing the quadricizer motorized therapy system. Therapy for people with ALS, Alzheimer's, arthritis, cerebral palsy, dementia, fibromyalgia, multiple sclerosis, Parkinson's disease, spinal cord injuries, stroke, traumatic brain injuries, and much more. The quadricizer helps to reduce contractures, depression, edema, muscle spasms, pain, pressure sores, spasticity, swelling, and more. The quadricizer helps to improve alertness, circulation, cognition, coordination, endurance, flexibility, gait control, mental acuity, muscle control, range of motion, speech patterns, strength, and quality of life. The quadricizer's gentle motion can simulate a walking pattern for those unable to move on their own. Movement equals improvement. According to the Franklin Institute, there is actually a physical connection between the brain and the muscles. It is called the neuromuscular junction, and chemical exchanges that happen at this junction are the key to your ability to move. When something happens in your life that takes away your mobility, that connection slows to a halt. The Franklin Institute also states that neurons not only contact other neurons, they also connect with skeletal muscles. At Quadricizer Corporation, we believe that for any level of ability, movement equals improvement. The Quadricizer works in a cross-crawl pattern, moving all four limbs in quadrupedal motion. This motion accesses both brain hemispheres simultaneously, facilitating integration. By coordinating the right and left brain, the information flow between the two hemispheres helps spelling, writing, listening, reading, and comprehension, as well as improving muscle function. This exercise helps coordinate right and left brain by exercising the information flow between the two hemispheres.
The quadricizer originated with the belief that therapeutic sessions of passive exercise can contribute significant benefits for people who don't have the option of active exercise.
I invented the quadricizer for my father. He was 88 years old, a diabetic, and the doctor told me in 7 days we're going to have to amputate his leg because of gangrene. And I said, isn't there something I can do? And he said, well, he just lays there and won't move. If we could get some circulation going, some movement, we might be able to postpone or prevent. So I went home to exercise him myself, and I knew I just couldn't physically do it enough. And I come up with a contraption that looked like Rube Goldberg, but it worked.
Since then, many people have made real strides toward an improved quality of life using the quadricizer. The quadricizer is a motorized therapy system. The motor and cables of the quadricizer gently move your entire body. It's fully adjustable to be completely customized for your specific limitations and for your comfort.
Extension, her right arm is very pulled in, and so we've been able to adjust the quadricizer to give good exercise to both limbs. And I said, with the glove, she couldn't have even held it originally without the glove, but now she can hold it with both hands.
The design of the quadricizer emphasizes comfort and security. The lower limbs are gently supported in comfortable padded cradles, which are freely suspended from the exerciser mechanism.
The quadricizer's range of motion works on multiple joints at one time, and just the ability to change certain positions of the foot placement, hand placement, and even the back support enables different ranges of motion at multiple joints at one time to be worked.
With the quadricizer, the motor and mechanisms can do all the work, or you can do as much of the work as you are able. Notice how effectively the quadricizer provides a range of motion that is highly similar to a natural walking motion. This walking motion is highly beneficial to your overall well-being. You want to improve your range of motion and strength. That's why the quadricizer's double cord system provides gentle coaxing for you to extend your range of motion. Other features include comfortable padded cradles that support the lower limbs in a bicycle-type motion. Quiet operation, so that you can enjoy normal conversation or listen to the TV or radio while exercising. Quadricizer is durable, with a construction that features a high strength-to-weight ratio. Minimal maintenance. Quadricizer will provide years of dependable use. Velcro gripping gloves are available to allow you to take full advantage of the arm exercise cycle without strenuous effort or discomfort. The quadricizer's ergonomic controls are easily accessible. Quadricizer features a timer control that allows you to receive therapy for a preset scheduled amount of time. And the speed controls allow your workout to take place at any speed you wish. For people who are unable to participate in more active types of exercise, now there is quadricizer.
Now back to Ron and how he used the quadricizer at physical therapy.
The first thing that they did every time I went in was to put me on the quadricizer for 30 minutes. For that 30 minutes of time after I got through, my hand, my arms, and everything were relaxed to where I could stretch better and get better movement because of it. To go to a greater range of motion after using the quadricizer. And that was the one thing that they measured. Everything was measured by your range of motion. And consequently, after using the quadricizer, you were always able to have better range of motion instead of a therapist to just stretch you and spend a 30 to an hour period of time just trying to stretch you out. They were able to go ahead and move into a greater area of range of motion with you.
We've talked about physical therapy and the quadricizer, so now let's look at exercise. Only 57% of stroke survivors are getting regular exercise. That's 43% who don't exercise regularly. Dr. Hillis of Johns Hopkins University School of Medicine directly states that it's better to get exercise after a stroke. She said sitting around is not helpful to the recovery process. Dr. Hillis strongly emphasized aerobic exercises such as swimming and jogging or other activity that gets your heart rate up. You might be asking, why exercise when you're already doing physical therapy? Well, for the same reasons you exercise before your stroke. Not to mention, exercise can help lessen or even prevent future strokes. Exercise controls cholesterol levels, which is very important in preventing another stroke. Exercise increases good cholesterol. Also, exercise fights high blood pressure by keeping your blood vessels working well. Many stroke survivors need to lose weight to reduce their risk of another stroke. Even if you are already at a healthy weight, exercise can help with weight management. Exercise fights depression, which is common after a stroke and can make it hard to feel motivated to do anything. But being physically active fights depression and, in turn, reduces additional risk for heart disease and stroke. Something to note. A German study found that intensive locomotor training combined with physical therapy resulted in a significantly better gait ability and daily living competence when compared to stroke patients receiving physical therapy alone.
I get on the wall, and I don't know if you know what a wall set is or not, where you just bend your body down and put all your weight on your legs and sit there for as long as you can. That's one of the exercises. I do ride the quadricizer as much as I can, try to do it once or twice a day. If I'm doing it diligently, it's twice a day. In the morning, before I start any kind of physical exercise. The other things that I do now is I try to lift weights with both arms. I have an E-stem device to help the pain, but it also can help me move my arm with an E-stem machine.
We've covered physical therapy and exercise. So let's see what Ron has to say about patience and perseverance.
It's just been a slow process, to be honest, and it's been, you just have to keep working at it as best you can. So it's ongoing. Just persistence and trying to overcome. One of the first things I did when they told me I couldn't work anymore, I tried to reach out to as many volunteer people as I could to work with them, to see what I could and could not do. I wanted to experience it personally, what I could and could not do. I did not want somebody telling me that I could not work, that I could not play golf, that I could not drive any longer.
Goals are extremely helpful in allowing you to be positive while you persevere. Be sure you set goals, both big and small, on your path to recovery.
Goals are important on anything that you may do, but goals as far as this is concerned is you get involved in other things. Just any little things that you can do, small steps along the way, helps you. The day that they gave me my driver's license was one of the major steps in my recovery of a stroke, or getting to a point to where that I can do things on my own. To be independent is my eventual goal, is to be completely independent of everybody, of my family, of therapists, or whoever.
Finally, it's very important to remember to always have a positive attitude.
And she walked up behind me and she said, "There'll be a cold day in hell when you ever walk again." So I told her the day that I came in and I walked without a cane, I said, "Hell just froze over today, by the way." No, well, at the time she hadn't been able to walk. This lady that was in the stroke club had not been able to walk. She had gone to all the therapy everywhere in the country, and she wasn't able to do anything. And so she just assumed because she couldn't do it that I wouldn't be able to do it. And that's even with their own person within themselves. You cannot say that you can't do it. Say that I can do it or will do it. Can't, never could.
For 12 long years, Ron Dillon was confined to a wheelchair, unable to walk, unable to drive, and unable to be independent. But after discovering the quadricizer motorized therapy system, all of that changed.
You got the driver's license, why?
So I could drive by myself.
Okay. And what helped you get there?
The quadricizer.
Okay.
This presentation is designed specifically for stroke clubs throughout America and brought to you by Quadricizer Corporation. If you are interested in learning more about the Quadricizer motorized therapy system, please contact us at 865-689-5003 or check out our website at www.quadricizer.com to see more information and testimonials.